Hi, this is Mark Davis with Workflow Diagnostics. Today I wanted to talk to you about our Lean Six Sigma Fundamentals training for healthcare. This training is designed to help you get the fundamentals of Lean Six Sigma into the hands of your frontline staff and managers, giving them a standardized framework for solving those workflow and quality problems that they encounter on a regular basis. Again, this is focused at the departmental level. It's designed to give you quick implementation of training, not something drawn out over several weeks or months. It creates a small disruption to your workforce during the time of the training, and it gives you a big return once it's done. So here's what we're doing. A 2-day course, 16 hours of training that we do on site at a neutral location. Preferably you get people away from their day jobs, using a cohort model where people begin and end training together as a group. About 12 to 15 participants at one time coming through each cohort. We think that's an ideal size. You might train 30 in your wave of training. You might train up to 100. It's totally up to you. Depends on what size of impact you want to accomplish with this training. But again, we're looking to create Lean Six Sigma problem solvers for their specific areas. You know, when we say 16 hours of training, we're not just talking about 2 days sitting at a desk, listening to me and some other guys and gals stand up there and talk to you. We're talking about a high energy, engaging 2 days of training, a very interactive type of situation, hands-on activities and exercises that we do as a group. We want to make this a thought-provoking training for everybody involved. We want to change the way people are looking at their work, looking at work as a process, looking at their workplace, seeing opportunities, and feeling empowered and equipped to go and make a difference in their departments and their places of work. So this will be a rewarding type of training for them. And we also look to make this a consultative model. What we recommend health systems do is they take personnel from their performance improvement, process improvement, or quality support department, whatever you happen to call it, at your health system, and you build these people into this training at some point also, so that they can come alongside the participants in this training, guide them through a project once they have learned how to do all of this and they're deployed out into the ranks. Now, we also recommend that participants bring a specific problem from their department to work on in this training. Examples of this: X-ray report times for the ED, supply availability or replenishment processes at your hospital, call bell response, big issue obviously, big patient satisfier or dissatisfier, as well as an impact on the health of your patients, staff overtime, staff safety or even patient safety issues that you might have, patients' complaints or concerns even from their families or others that are with them that you hear often, handoff or communication processes between providers or between departments and units. It might be an equipment maintenance or a lockout or tagout procedure that you're trying to refine or streamline. Specimen control. This could be the gathering of a specimen and the control of it all the way down through the chain from the care department to the unit all the way to the lab or wherever that specimen happens to go. So just some ideas that people can bring to this training, and we do recommend again that participants each bring a problem that they can begin working on during the course of this fundamentals training. So as you can see, our key objective here is to make problem solvers out of your folks using a specific method, the Lean Six Sigma DMAIC problem solving method. We want to teach them to see work as a process, to see the waste and the variation in that process. And the way that they do that is they learn how to map the process, to analyze it once they've got it on paper, once they've gone and they've looked at it and they now are recognizing areas of waste and variation and issues that are there, so that they can now analyze where those issues are coming from and improve that process, implementing that change and sustaining it. Again, all of this built into the DMAIC process, so that they're then equipped to lead a small change effort. We're not talking about necessarily green belts or even black belts particularly here. We're talking about those who might be considered super users of Lean Six Sigma, who are equipped to take a small, confined problem and make a difference, engage people in addressing that, not doing it on a full-time basis, obviously, and not necessarily doing it on a broad scale. But this will increase their value to the organization as a problem solver. And along the way, that's going to increase the value of your organization as more people have this problem-solving acumen. So the benefits are probably obvious at this point. You're looking at deploying a new fleet of problem solvers and process improvers out into your organization with a standardized method for solving problems, helping improve quality, helping improve efficiency. An iterative method, the DMAIC framework, that can be used over and over again and make an exponential impact on your operations. Think about this. If you just train, say you train 100 people this year, and each of them is able to make just a $5,000 impact on your operations, very feasible, by the way, then do the math on that. That's $500,000. And let's just imagine that they continually do that. That's $500,000 on a regular basis. Obviously a big impact to your operations. We're looking at people who are more efficient and process-oriented thinkers, looking to reduce costs and waste continually, looking to reduce variation and the errors that come from uncontrolled variation continually. This will have immense benefits for your organization. So what are your next steps? If you're looking to empower your staff with the tools and methods for solving problems and improving results, then this fundamentals course is a great fit for you. You need to contact us today. We can create a training program that is right for you and help you transform your health system. So you can contact us through our website at workflowdiagnostics.com. You can also call us at 1-855-FLOWDOC. And if you like, you can follow us on Twitter at WorkflowDX. And of course, you can check out all of our videos right here on our YouTube channel, Workflow Diagnostics. Hope you have a great day, and we look forward to working with you.